unakuta saa zingine jua ni wingi.
Government, in collaboration with the county governments, we are running a very robust program of community health. And we rolled out 100,000 community health promoters across the country. And later on during the summit, we added another 7,800. So in total, the number of community health promoters on the ground is 107,080 across the country. In Kisumu specifically, we have about 2,900 community health promoters who are working, and each community health promoter has been designated 100 households. In Kenya, an average household has around 5 people. So if you have 100 households, you have around 500 people to serve within that month and continuously. Right now, we are in the process of registration of the households. We want to know where the households are and how many people are there so that we can serve them better. And in the course of the registration, we are equally doing the community service and giving them the services that they are required. The role of a community health promoter is very basic. First aid, blood pressure, blood sugar, reminding the caregivers and mothers time for immunization and vaccination for their children, championing issues around climate change, ensuring that common public health activities are taken care of. If there is an outbreak, it is the community health promoter who will inform our officers, our skilled officers at level 2 on what is happening at a certain place. So issues of vector-borne diseases, waterborne diseases, foodborne diseases, we are able to contain them at the household level. That is why the training is very, very critical. You realize these things are not just something you can wake up one day and know them. It is paramount and it is important that the community health promoter is trained extensively, intensively, so that they are able to cascade the same information, health promotion at the bottom of the pyramid. Today we have about 2-3 training centers in Kisumu, and for my work right now is to ensure that the real job is being done on the ground as a PS, so that I'm able to know where we are, the budgets are going, and what we budgeted for is actually taking place. We have already trained earlier and kitted them, so they have kits that have all those gadgets. And we really need to activate and ensure that in our electronic, in our itches, it is showing. I have a dashboard in my office where I check every morning how many households have been visited in a day, how many people have been referred to hospitals in a day. And our referral system is making this better, what we call the primary care networks. A primary care network is a group of health facilities in a certain geographical area which have been mapped out to serve the people in that area. So the community health promoter is level 1 in our referral system. So whenever she detects or he detects something, refers them to level 2. And if the level 2, which is manned by a nurse, they are not able to take care of that issue, then they refer to level 3, where we have our clinical officers, and so on and so forth, until where you can find the specialist. That is our referral system. So we have a lot more to train them. We have equally reviewed our training module, which now is inclusive of communicable diseases. We have issues to do with climate change, which is a big phenomenal issue globally and in our country today. So these are modules that we need to train them through so that they are able to champion. Remember, His Excellency the President has already declared the third Thursday of every month to be a tree planting day. Climate change and health are intertwined in the hip. You cannot separate them, because the extreme weather changes the extreme heat, the extreme rainfall affects directly or indirectly the ailments or the diseases that are coming from the households. May it be cholera, bilharzia, foodborne diseases, vector-borne diseases like malaria. All of them are preventable diseases, and they can be able to be prevented at the household. The other thing that we will be training the CHPs about will be about the social health insurance, which we are rolling out and which all the households are supposed to register, so that you benefit from the 300 shillings that you will be paying and the 2.75 that I will be paying and yourself will be paying. Therefore, it will be important to go and let the people know what are the benefits that they are acquiring by registering at the social health insurance. And remember, our social health insurance, which is the NHIF expanded, requires you to pay 300 as opposed to the 500 shillings that used to be paid. We have three funds. We have the primary care fund, we have the social health insurance fund, and we have the emergency and chronic illness fund, which is a new one. Remember this chronic emergency and chronic illness fund. We never used to take emergencies in our hospital. You fall with a motorbike, you go there and you're asked for money, or you can die on the coach. But right now we have a fund that can be plowed back and treat you without asking you questions. We never used to have people in HDU and ICU. You had to pay. But right now, if you're taken to ICU or HDU, then we plow from the chronic emergency and chronic illness fund to treat you without asking you for any money. For the social health insurance, once you register with the 300, you can access any health facility at level 2 and level 3 without going back to your pocket. And those are some of the benefits that we will need the masses to know, that anytime you go to a dispensary that is rated level 2 or level 3, you will not be required to pay the 20 bobs that you used to pay. You will not be required to do the registration of 100 shillings that you used to do. You will be required to just produce your ID. We verify that you are a registered member of the social health insurance, and you will be treated for free. Then again, if you look at the Digital Health Act, which is equally in place, which helps us with the referral system. Because if I have to refer you from level 2 up to level 6, then you don't have to go repeating yourself. You know, sometimes diseases can be a bit embarrassing, and especially when you have to keep explaining to everybody. Sometimes we just tell people, mimi ni mgonjwa, but you don't go to the details. Now imagine if you have to explain to a human being. From every stop you go telling them, you know, mimi ni mgonjwa, niko na kansa, niko na nini, nilichinjwa jana, nilifanywa. Those stories are sometimes very humiliating, and especially for disease, long-term ailments that make you feel really down. Therefore, the Digital Health Act will help us with interrelatability of data to ensure that if you're referred to another health facility, then you go there, you will find the health worker waiting for you and knowing what you are being treated for, what you are prescribed for, and if there is any change, then they can make at that particular time. It makes people feel at ease whenever you go to hospitals to be treated. Therefore, ladies and gentlemen, I think I've summarized everything. And we already have registered 6.4 million households across the country. And that is out of the 12 million, because Kenya has roughly around 12 million households. We've already hit the half mark of registration. Then we have been able to assess about 3.9 on diabetes, and about 60,000 of those have been referred to a health facility. Because it's not just about getting blood pressure from me and diabetes, it is also about telling you, I am not able to treat you, can you go to the next level? And that is what we have been able to do. We've been able to visit more than check about 180,000 children across the country. And this is to just basically see the minor ailments that children get, and sometimes their parents don't get to know. So it is important to also keep referring them to the health facilities so that they can be checked by pediatricians or somebody who is more skilled to check on what the children are going through. On issues hypertension, we have about 3.8 million people who have already been visited, and about 180,000 they have already been referred to the health facilities.
For clarity purposes.
You are watching Royal Advanced Net TV.